Good morning, everyone. Good, you're awake. I love it. Welcome to the Mayor's Alliance for Persons with Disabilities Employer Seminar. And today we're going to be talking about accommodating individuals with disabilities, all the ins and outs. You're going to get a lot out of it. I would like to introduce the person who's responsible for this. Is Karen Sinrich is the American with Disabilities Act Coordinator for the City of Tampa and the liaison for the Mayor's Alliance for Persons with Disability. She has her PhD in Rehabilitation Counseling from New York University and has worked in the field of disability for 40 years in both the public and the private sector. She was recognized by President George H. Bush for her efforts in helping to secure the passage of the American Disabilities Act. She is the creator of the webpage Accessible Tampa Guide that provides information on resources for persons with disabilities and their families and produces a quarterly newsletter. Let's welcome Karen.
Thank you, Larry. I'm here to introduce our first speaker, Jack Humberg. Jack is the Director of Housing Development and Americans with Disabilities Act Services with Bowley Centers Incorporated. Mr. Humberg has served as the State Network Administrator for the Florida Americans with Disabilities Act Leadership Network for the past 21 years. This network is the state affiliate of the Southeast ADA Center, which you'll find on the list of resources for employers. It's a very valuable resource. Mr. Humberg has received extensive training on the ADA Fair Housing Act through the federal enforcement agencies, including the Department of Justice, EEOC, the Access Board, and HUD. Mr. Humberg is responsible for the development of affordable housing at Bowley Centers, which owns or manages over 650 units of affordable housing and administers over 420 Section 8 vouchers for individuals with disabilities in Pinellas County. Mr. Humberg is the chair of the Accessory Advisory Committee of the Florida Building Code Commission, president of the Disability Achievement Center, and serves on the board of the Florida Housing Coalition and the Florida Supportive Housing Coalition. Mr. Humberg holds a Master's of Art degree from Ball State University. He is a certified rehabilitation counselor and a certified professional of occupancy, and we are very fortunate today to have Mr. Humberg make the presentation. Thank you.
Good morning, everybody. Good morning. Are you awake? 8 o'clock, we're all up and ready to go, right? All right. Let me ask you a question. On a scale of 1 to 10, if 1 is when you walked in here this morning you thought the ADA stood for the American Dental Association, and a 10 is you should be up here doing this presentation instead of me, where do you put yourself on that scale of knowledge about the Americans with Disabilities Act? How many are under 5? Yeah, I got a couple. How many are you are in the 8 to 10 range? We got a lot of experience in the room. Okay, good. Well, we're going to talk a little bit about the ADA, but not a lot. We're really going to talk about accommodating people with disabilities. I was asked to do a little disability sensitivity, etiquette kind of stuff, so we're going to talk about those things with the overlay of the Americans with Disabilities Act. And we're going to talk a little bit about that first. As Karen said, I'm part of the ADA network. There's a national ADA network that's funded through the U.S. Department of Education. Their National Institute on Rehabilitation Research funds 10 technical assistance centers around the country, and that technical assistance center here in this region is up in Atlanta. Actually through Syracuse University. And they in turn have an affiliate in each of the states in this region. And in Florida, that affiliate is Bowley Centers, and namely me. And we provide technical assistance and training on the ADA throughout the state of Florida. And we work with the local centers for independent living, like Self-Reliance here in Hillsborough County, the Disability Achievement Center in Pinellas and Pasco County, and others across the state, to help individuals with disabilities understand what their rights are and what they're not, and to help employers, local governments, and local businesses understand what their obligations are under the ADA, and again, what they're not obligated to do. So, for all of you above 5. This is old news, but let me also remind you that next year will be the 25th anniversary of the Americans with Disabilities Act. 25 years. Pretty impressive. We've come a long way in those 25 years. Where we've not done so well is in the employment of individuals with disabilities, and that's one of the reasons we're talking to you today. 5 titles to the ADA. Title I covering employment covers employers who have 15 or more employees. Title II is public entities like the counties, schools, so on, public entities. Title III covers places of public accommodation, private businesses that are open to the public, that invite the individuals to come in and buy their goods and services, are covered under Title III of the ADA. Title IV covers the telecommunications provisions, provides for a relay service. So you may get a call one day from a Florida relay operator. It's not a telemarketer. Don't hang up on her. But if you get, that's mandated under Title IV of the ADA, that there is a relay service for individuals who are hearing impaired or speech impaired, that they can call that relay service and they will relay that telephone call to you back and forth using the telecommunications device for the deaf. Title V covers a bunch of miscellaneous things like the Department of Education being responsible for providing technical assistance and training, and the enforcement agencies. Title I is enforced by the Equal Employment Opportunity Commission. Title II and III are enforced by the Department of Justice. So under employment provisions, the Equal Employment Opportunity Commission enforces Title I. So who's entitled to protection under the ADA? The definition of an individual with a disability under the ADA is a person with a physical or mental impairment that substantially limits one or more of a major life activity. So it's an individual with an impairment, but not just an impairment, it must substantially limit one or more of a major life activity. I hit the ripe age of 45 and I had to get glasses in order to read my morning paper. I have a visual impairment, but I still drive, I still work, I can still take care of myself and my family. I'm not a person with a disability because of visual impairment, even though I need my glasses to read. Now, if my vision gets worse, maybe I'm no longer able to drive, maybe I'm no longer able to see print without amplification or additional technology, maybe at that point I've reached the point of a substantial limitation in the major life activity of seeing. Major life activities can be a variety of things, including working. But typically, we're looking at major life activities like walking, seeing, hearing, and so on. You could have protection if you have a record of impairment, but you're no longer disabled. Perhaps you had cancer, you received treatment, you were in the hospital, you were out of work for a while, you had substantial limitations in major life activities, and you were disabled during that period, but you got better. Your cancer goes into remission. You're back to work. But you're discriminated against on the basis of that record of an impairment. No longer disabled, but discriminated against on the basis of that record, you could still have protection. You could have protection if you are regarded as having a disability and never had one, but your employer assumes that you have a disability and discriminates against you on the basis of that, you could have protection under the ADA. I know your significant other died of AIDS, and I assume you must have AIDS, and discriminate against you on the basis of that, you could have protection under the ADA, even though you were never a person with a disability. Okay? A couple of years ago, in 2010, the Congress went back and said to the court system, there had been a number of Supreme Court decisions that narrowed the definition of a person with a disability. And they passed the Americans with Disabilities Amendments Act to say, no, we wanted this to be a broad law providing protection for people with disabilities. Stop arguing over whether the person has a disability and get on about providing the accommodations. So the Amendments Act were meant to restore that original definition to a broad definition of individuals with disabilities. I only have like 30 minutes here, so I'm going to breeze through this as quickly as I can. Title I general rule is no covered entity, that's an employer with 15 or more employees, shall discriminate against a qualified individual with a disability because of that disability, and it covers essentially the entire employment process, from hiring and advertising for a job to retirement, and the various steps along the way, including compensation, job training, and so on. It applies to new hires, and it applies to existing employees. And pre-employment inquiries should not be disability related and should be consistent with business necessity. At the pre-employment phase, you don't want to be asking about the person's disability. You want to be asking about their ability to do the job, all right? And we're not going to get into too deep into that. But it's for a qualified individual with a disability, and that's an individual with a disability who satisfies the skills, experience, and education requirement, and who, with or without a reasonable accommodation, can perform the essential functions of the job. All right, and we're going to talk about the underlying phrase there, with or without a reasonable accommodation. So what is a reasonable accommodation? An employer must provide reasonable accommodations to the known physical or mental limitations of a qualified applicant or employee with a disability. So, first of all, you have to know about the individual's disability. And we counsel and we work with individuals with disabilities and help them find jobs. And so one of the things I say to them is, you do not need to reveal the presence of a disability to your employer. You don't have to reveal your medical condition to an employer unless you're requesting an accommodation. If you need an accommodation in order to do your job, then you have an obligation to reveal that to your employer and request the accommodation. But if you don't need an accommodation, you're not asking for any accommodation, you have no obligation to reveal the presence of a disability or any impairment to your employer. Okay? Reasonable accommodations are a modification or adjustment to the job or employment practice or the work environment that makes it possible for an individual with a disability to enjoy an equal employment opportunity. And they're required in 3 areas. The first area is, of course, the application process. You may have an individual who needs assistance with applying for the job. They may not need any accommodation to do the job. They may just need an accommodation to apply. Take an individual with an intellectual disability. Perhaps you're hiring a person to work in a custodial position. They're not going to need any assistance to do the job, but they need assistance to fill out the application. They may need accommodation just to apply for the job. An individual who is deaf may need a sign language interpreter in that interview process, but the job they're going to do is not going to require them to have an interpreter. Okay? In the performance of the essential functions of the job. And again, the employer determines what are the essential functions of the position, and that's where you need to provide accommodations to allow that person to be able to perform those essential functions. If it's a marginal function, not central to the job, you don't have to provide an accommodation for marginal functions of the job. Okay? But if it's an essential function, what are essential functions? Well, that's what you hired the person to do, right? The essential function of that position. There may be marginal peripheral duties. Those are not necessarily required to be accommodated. Only the essential functions. And then there's the third category of the enjoyment of equal benefits and privileges of employment. Getting a cup of coffee is not an essential function of my job. Some days it feels like it, all right? But if I'm an individual in a wheelchair, and I'm using a wheelchair for ambulation, and I'm in that office and I can't get to the coffee, even though it's not an essential function of my job, it's a benefit of employment. It's part of the employment experience, and you need to accommodate those kinds of things. If you have your company Christmas party on a cruise ship that's inaccessible, and an individual in your employment cannot go on your Christmas party because it's inaccessible, that is discrimination against that individual, okay? So the benefits of employment include those kinds of things like insurance, like benefits that you might provide to that individual, and you need to provide accommodations for those as well, even though they're not essential functions of the job. Just a few facts about accommodations. Over 70% of employees with disabilities will never request an accommodation. Most people don't need one. You provide accommodations to individuals all the time who don't have disabilities. Okay? So we're not talking about a large burden on the part of employers. 56% of employers report the cost was nothing to provide the accommodation. You allowed the person to get off an hour early to go to treatment or something of that nature. There may be a small negligible cost, but in most cases, there's very low cost to providing accommodations. 74% of employers report that the accommodations were effective. And this is data from the Job Accommodation Network that's been updated several times over the past 2 decades. If you look at the average cost of accommodating, 31% didn't cost anything, and most accommodations are in the $500 or less range. So let's talk about some examples. Restructuring a job by reallocating or redistributing marginal functions is a form of accommodation. Let me say that reassigning an essential function of a job is not a form of accommodation. If it's an essential function to that position, the person needs to be able to do it with or without an accommodation. If you've accommodated and accommodated and accommodated that individual to perform that essential function, and they still cannot do the essential function of the job, they're not qualified, okay? But restructuring a job, assigning marginal functions to someone else is a form of accommodation. Reassigning someone to a vacant position is a form of reasonable accommodation, but again, they must be able to perform the essential function of that job. And if it's a lower paying job that you're assigning them to, then it's a lower paying job. They may have to take a cut in pay. So reassignment to a vacant position is a form of accommodation, but again, they must be able to perform those essential functions with or without an accommodation. Altering when or how an essential function is performed is a form of accommodation. Providing part-time or modified schedules, shifting time to allow a person to get treatment or to deal with symptoms of their disability may be a form of accommodation. Obtaining or modifying equipment, we're going to talk more about that today, is a form of accommodation. Modifying examinations, providing qualified readers, qualified interpreters for an individual with a communication disability is a form of accommodation. It's essential that the accommodation be effective. The bottom line is you're trying to allow that individual to stay on the job and perform the essential function of the job that you need them to do. So if you're going to provide an accommodation, it should be an effective one. It may not necessarily be the best, but it needs to be effective. Individual with a disability wants the Cadillac version of the software for their computer, but the Hyundai version works just fine. Excuse my expression, but I own a Hyundai. And that's fine. If it works, it doesn't have to be the Cadillac version. It can be the Hyundai version, all right? But it must be effective. Personal devices are not required. You're not obligated to provide things like wheelchairs, hearing aids, glasses. Personal devices are not accommodations that employers are required to provide, okay? There's nothing stopping you from providing that Cadillac version or going beyond or working with that individual to determine what's going to be the best solution for them, okay? Accommodations vary depending upon the need, of course, and the employee and the employer and what's going to work in your workplace and not disrupt the workplace, for example. Not all persons with disabilities or even all persons with the same disability will require the same accommodation. It's an individualized assessment. And keep in mind that if you have a person with a physical disability that needs physical access to your workplace, that doesn't mean that it has to look like the Florida Building Code. It's individualized, okay, on the basic needs of that person. So we need to make modifications to allow them to use the restroom, but that doesn't necessarily mean you need to provide the kind of restroom that you would build in a new building for public accommodation, you know, with the lavatory and the stall and so on. What does that employee need? He may need a grab bar in an unusual location, but that's what that employee needs in order to use that restroom, so that's what you provide. You follow me? EEOC says that employers and the individuals with disabilities should engage in an interactive process. Sounds nice, doesn't it? We're going to interact. But what that really means is talk to the individual, find out what's going to work for them, and communicate back and forth. Once they've revealed to you the presence of a disability and the need for accommodation, who's the best person to tell you what they need? Them. So talk to that individual, okay? Look at the job and determine the essential functions. Consult with the employee. Select an accommodation that best addresses the needs of the employee and the employer. Consider developing accommodation policies and request forms. If you have an accommodation policy, it's good to let people know. Let them know how to ask for an accommodation. And if necessary, provide a form for that. It may help them formulate what they're trying to ask for, but they may not know what they need, okay? So if you have some type of a form, it may help them formulate the kind of request for an accommodation that will help you, as an employer, give them what they need. You don't have to have a form, and it's important that that you allow that individual to disclose the disability and explain to you what it is they're looking for, okay? Don't be afraid to ask for documentation. If a person reveals the presence of a disability and says, I need an accommodation, you as an employer have the right to say, prove it. Provide me with some documentation that there is indeed a disability. And if you have an individual who can provide documentation of the accommodation request and how that's going to be effective, then that may be really helpful. For example, an individual with a disability who's gone through a particular trade school and was accommodated in that school. Maybe they're a one-handed typist and they used a one-handed keyboard. Well, you don't happen to have a one-handed keyboard at your office, but they may bring one with them. Or they may say, I use a one-handed keyboard, and with a one-handed keyboard, I can meet your standard of 65 words a minute. So that's the kind of thing that they can bring to you, okay? And make sure that managers and supervisors recognize when somebody is making a request for a reasonable accommodation. If they're going to their direct supervisor, that direct supervisor may not be in the room today, right? They may not know much about the ADA or much about this process. But provide some training to your employees, particularly managers, that when someone comes to you and says they need accommodation, they need help, before you turn them away, you need to consider, is this a request for an accommodation under Title I of the ADA? Do we have an obligation to consider this request before we turn it down? And make sure that goes up the chain of command to someone who can make that decision appropriately. Okay? Employees have responsibilities. The process is initiated by that employee with a disability, and disclosure is required. They may need to provide documentation and be involved in the process. Implementing an accommodation could include providing training on use of that accommodation. Consider implementing a centralized funding mechanism in your business. Set aside some money in your budget. If you have a lot of employees, you may have a need to have a fund in your budget for accommodating employees, particularly if you're serving individuals who have deafness, who are requiring interpreters. You may want to budget for that into in your annual budget. Monitor implementation. If it's being implemented in an area where you're not necessarily seeing that all the time, you may want to monitor what's going on and how that accommodation is being implemented. Is it effective or is it not? Is it being wasted or do you need more of whatever it is you're providing? And provide documentation. I encourage you to document that you've received a request, how you looked at that request, particularly if you're going to deny that request. Document your decision-making process. Okay? When is it an unreasonable request? When it's considered an undue hardship on the employer, it's considered not a reasonable accommodation, okay? And that is defined as an action that is unduly costly, extensive, substantial, or disruptive, or would fundamentally alter the nature or operation of the business. So cost is on the list. It's the first thing on the list, but it's not the only thing on the list. It may be, as we saw earlier, the accommodation doesn't cost much at all, but it may fundamentally alter the nature of your business. It may disrupt other people in the operation. It could be a kind of extensive, substantial disruption that doesn't cost much, but is an undue hardship on the employer and not required under the ADA. Examples, well, say you have, this is kind of the typical example, but say you have a restaurant, and it's a romantic French restaurant, low lights, candlelit kind of, and you have a waitress who has a visual impairment, and she wants the lights turned up, right? Doesn't cost much to turn on the fluorescent lights, but it may fundamentally alter the nature of the business that you're providing. All right? By turning up the lights, it alters the ambiance. So that's the kind of undue hardship that doesn't cost a lot of money, but could fundamentally alter the nature of the business. Undue hardship is a significant difficulty or expense incurred when considered in light of the nature and cost of the accommodation, the overall financial resources of the operation, the type of operation that you provide, and the impact of that accommodation on the operation or the ability of others to perform their job. It must be determined on a case-by-case basis. Again, it shouldn't be the frontline supervisor who makes that call. It should be somebody who up the line, if you will. And recommend that denial of a reasonable accommodation request be made at the appropriately high level of management. And before you say, no, we're not going to do anything, consider, is there another kind of accommodation that would be effective that would allow this person to do the job? Again, they may request the Cadillac, but you may decide that, no, the Volkswagen's fine, okay? And if it's effective. Eliminating essential job functions is not a form of accommodation. If it's an essential function, you don't have to eliminate it or reassign it. Lowering production standards is not required. Providing personal use items, as I mentioned before, not required. Or excusing violations of your uniform applied conduct rules, not required. There was a very famous case here in Tampa several years ago where a man brought a gun to work and claimed he did it because of his disability. Well, that made the front page news. When it got thrown out of court the next day, that was on page 18, you know. It was shocking that this man said his disability caused him to bring a gun to work, but the courts did not support him in that request for accommodation. Okay. Confidentiality, there should be strict limitations on the use of medical information. Anytime there's medical information, it needs to be kept in a separate file from the normal human resources file, and that information should only be shared on a need-to-know basis with those in your business, okay? And that includes sharing information with coworkers. If the individual wants to tell them about their disability, that's his or her business, but it shouldn't come from the supervisor or the manager explaining to the coworkers that this person has a disability. That information needs to be kept confidential. Coworker resentment, you may have a situation where coworkers say, why is he getting accommodated, all right? You can explain that you're acting for legitimate business reasons, acting in compliance with federal law, trying to support the needs of the employees, but don't disclose the individual's disability, all right? Clearly communicate to coworkers that the accommodation is not preferential treatment, and if it's possible to extend those benefits to others, then you can do that as well. Of course, that's your decision. So a little disability sensitivity, and I know I'm running out of time quickly.
You have another 15 minutes, just there won't be time for questions.
Okay, all right. Well, the first rule of disability sensitivity is, of course, do unto others as you would have them do unto you, right? The golden rule. Think about what you would want in this situation and treat others accordingly. Think ahead, be proactive. Do you know how you would get a sign language interpreter if you needed one? Do you know how you would get something brailled if you needed it? Think ahead so that when that occasion occurs, you know where to go. You know who to ask, you know where to get an interpreter, for example. If you build it, they will come. If your services and your business is accessible to people with disabilities and welcoming to them, they'll come back. It's good business. I encourage you to maintain accessible features. There's nothing more frustrating than having a beautifully accessible restroom that people put their file cabinets in, because there's lots of extra room in there, right? We've got all this clear floor space, let's put a big cabinet in there, blocking the accessible features. And certainly you see this in restaurants all the time. The pathway to the accessible restroom is full of carts and other stuff that's in the way. Maintain your accessible features. Don't be afraid to ask, and always ask before you jump in to help. Don't be afraid to ask a person, can I help you? They may say no. That's fine. But before you grab a person's wheelchair to push them, ask, okay? Don't be afraid to change the way you've always done something to accommodate an individual. We've always done it this way, we can't change it. Well, sure you can. You can change it to allow this person access to your business or to that job. And of course, use common sense. Watch your language. Do use people first language. You hear me this morning talking about an individual with a hearing impairment, a person with a disability, that individual who has low vision. We don't say the blind, the deaf, all right? Use people first language, all right? Individuals with disabilities, persons who have mental illness, people who are blind or low vision, not the blind, okay? Don't use handicap. Handicap refers to a time when individuals in England who were poor and disabled had hat in hand as beggars, okay? It's considered derogatory these days. You don't use the term handicap. The parking space isn't a handicap parking space, it's just fine, okay? It's an accessible parking space, but we don't use the term handicap, all right? Except on the golf course, where I'm about a 30. And that's not good, all right? So don't use the term handicap. Wheelchair bound or confined to a wheelchair. Most individuals in wheelchairs are not bound to a wheelchair. And don't be surprised if you see someone that you've always known was a wheelchair user stand up and walk across the room one day. Not everybody. They may be using a wheelchair for ambulation because they can't walk long distances, but they may be able to stand. They may be able to transfer to a chair. They're not bound to the chair. They're not bound to their home, all right? So don't use those kind of terms. So, for individuals who are deaf or have a hearing loss, speak directly to that person with a disability, not to their interpreter. If they have an interpreter, don't say, will you tell him to go over here and fill out his application? No, speak directly to that individual. The interpreter will do their job. They have a code of ethics. Speak directly to that individual just like you would anyone else, like the interpreter wasn't there. And when they sign back to you, that interpreter will tell exactly what that person is saying, okay? If you've got a qualified interpreter. Face the person and speak clearly. There's no need to shout, all right? Don't obscure your face with a piece of paper or the newspaper if you're trying to talk to an individual who has a hearing loss. Speak clearly and don't chew gum. For a person who is deaf, an individual who's been deaf their entire life, a sign language interpreter may be the only means of truly effective communication. I have definitely run out of time.
He's got another 10 minutes he can take if you want to take for questions.
Sorry about that.
Accommodations for individuals who have a hearing loss may be an amplified phone, right? Text messaging, the use of email. Someone comes up to you and starts signing away and you don't sign. Pull out your cell phone and text back and forth to them, or write notes back and forth to them, all right? Almost all individuals who are deaf use cell phones now. They have a smartphone. They may be using video remote interpreting on their smartphone, right? So don't be afraid to try to communicate. You write notes back and forth or pull out your cell phone and text back and forth. Perfectly appropriate. Printing information and the use of capping or sign language interpreting could be a form of accommodation. Having a fire alarm with a horn and strobe smoke alarms with a horn and strobe in your workplace so that individual with a disability knows that the fire alarm has gone off. Important to have if you have an older building that hasn't been upgraded to include those. This is a picture of a committee meeting in St. Petersburg where the chair of that committee was a lady who was late deafened, became deaf as an adult. She didn't use sign language, but she used CART, or Communication Access Real-Time Captioning, in that meeting where a transcription is going on in front of her so she can follow what's going on in that meeting. Individuals who are blind or have low vision, initiate contact. When you walk into the room, there's a blind person there, tell them you're there and tell them who you are, all right? And tell them when you're leaving, all right? So they know who's in the room. Don't take that individual's arm and say, here, let me help you. Offer to give them your arm. Let them take your arm and you lead them. Don't grab the person and try to steer them, okay? Orient a person to their surroundings. If you walk in a room like this with a person who's blind, say there's a bunch of chairs in the back of the room. Tell them what's going on in the room and give them an orientation to where they are. Accommodations may include readers, and a qualified reader means somebody that can understand the information that they're reading. Not the person who's flunking the class, okay? You want a qualified reader. Text-to-voice software is very easy to get now. I remember when I started at a rehabilitation facility 25, 30 years ago, it cost us $60,000 to get this software that would read the screen, and it was horrible. And today you can go to, Best Buy and get it for $60, and it works fantastic. So the software's out there, it's easy to use. Large screen monitors and large text, zoom text kind of things that blow up the words on the screen to very large fonts. If you're providing print, you may want to provide large print, at least 16 to 18 point font, maybe larger. Braille. There are very few folks who read Braille these days, but there are those who will request Braille documentation so they can take it home and study it. And there's an organization here in the Tampa Bay area that will provide Braille for you. You may have a situation for a person who has any disability that's using a service animal. The new definitions under the ADA is that a service animal is a dog. It's a dog, it's a dog, it's a dog. Unless it's a miniature horse, okay? But there's no service cats, there's no service ferrets, there's no service snakes. It's a dog, it's a dog, it's a dog, okay? And believe me, there have been service ferrets. You may have a situation where you need to provide audio description. You're showing a video to a blind person. You need to describe that video to them, who's on the screen, what's going on. Okay, individuals with mobility disabilities. Again, don't grab that person's wheelchair without asking first. Don't lean on the wheelchair. It's their personal space, okay? Ask if you can help and don't be surprised if they say no. Keep your aisles and ramps, doorways clear of clutter, okay? Be aware of that person's reach range. If there are items that they need to reach, can they get to them, or is that coffee up on a shelf somewhere where they can't reach it? If you're going to have a conversation with a person who's using a wheelchair, have a seat. Sit down eye-to-eye level with them, okay? Don't stand over them if you're going to have an extended conversation. Accommodations may include putting a desk up on blocks. It may include taking that pencil tray out of the desk so they can get under to use their computer. Simple accommodations. We may be restructuring a job. I went ahead, didn't I? You may have a speakerphone or large button phones for an individual who is quadriplegic. They may need a larger mouse that they can use rather than the little tiny ones, right? So there's adaptive equipment that may be helpful for an individual who's a quadriplegic. Installing grab bars, as I mentioned before, and installing that grab bar in the position that that individual needs it to be installed in, okay? Gripping aids for persons' use of pens and other equipment, or a one-handed keyboard, and we're going to see some demonstrations of that coming up. Other disabilities, a person with cancer or other conditions may need time off as an accommodation. A person with diabetes may need more frequent breaks to eat and make sure that their blood levels, sugar levels are correct. A person with a learning disability may need extra time to complete a certain task and may need some extra instruction on how to perform that task. A person with a back injury may need a belt to assist them with lifting devices, or a hand truck or other kinds of lifting equipment. If you are working with individuals with intellectual disabilities, they might have a job coach. Do you know what a job coach is? And will you allow a job coach to come into your work site and assist that individual as a form of accommodation? They may need to restructure the job, or you may need to provide instructions in a different way than you would normally provide, such as diagrams or pictures or a flow chart showing how that person would perform the job. A checklist, for example. You may want to provide information on an audio tape that you would normally just hand them a piece of paper. But if that person has difficulty reading, a taped version may be a better solution. You may have individuals with hidden disabilities that they disclose to you. A person with a psychiatric disability or post-traumatic stress, for example. Ask what would make them comfortable, you know? Don't panic if there is a person with a psychiatric disability that's acting out. Try to calm them down and work with them and ask them what's going to make them more comfortable. You may want to try to reduce distractions in the workplace or divide larger assignments into smaller assignments. You may have a person with multiple chemical sensitivity, and you need to be aware of not having perfumes and sprays and other kinds of odors that and chemicals that might aggravate that individual's disability. And there's a word about confidentiality here. I won't read this to you, but just be aware that that person reveals a disability to you that should be held in confidence. Okay. And you may be concerned about their welfare. You may be concerned about your coworkers' welfare. But don't put on the bulletin board, Johnny's out for whatever medical reason, send him a card. All right? You've then violated that person's confidentiality. Perhaps in good faith, but nevertheless, be aware that that should be held confidential. More information here. The Job Accommodation Network is a great resource. I encourage you to go to askjan.org if you're looking for ways to accommodate a person. The Able Data website, abledata.com, you can put in a disability and it will show you all kinds of different accommodations that might be helpful for that disability. Or you can put in a particular device and it will show you what kind of disabilities can benefit from that. There's all kinds of great resources. Including the Division of Vocational Rehabilitation that provides assistance. The Division of Blind Services here in Florida will provide assistance for individuals with disabilities and help them get to work and keep working. And of course, EEOC, the Southeast ADA Center, if you call the 1-800-949-4232, that will contact the regional center up in Atlanta. If you ask them a Florida specific question, they'll refer you to me. And there's some other additional resources. Copies of the slides are in the back if you didn't get one. And I thank you very much for your time. Questions?
Our next speaker is Nancy Mashberg. Nancy is she received her master's degree in clinical and community psychology from the University of South Florida in Tampa. She's been employed as the FAST Central Regional Coordinator since 1997 and has her certificate in school psychology, assistive technology applications from the National Association of State Directors of Special Education. During her time working with the FAST program, she has served on a number of state and regional assistive technology committees and work groups. Today, Nancy will be presenting information about assistive technology and the Florida Alliance for Assistive Services and Technology, also called FAST, Florida's assistive technology program. Examples of assistive technology to assist individuals with disabilities in the workplace will be highlighted. Thank you.
Good morning. How's everybody doing? Yes, we need to move around. We're all okay. I know in this kind of temperature, I need a little moving around. Even though I had warning it would be a cold room, it's a cold room. So hi, good morning. I'm Nancy Mashberg, and I'm the regional coordinator for FAST, and I'm going to be talking to you about assistive technology. I'm going to be talking to you about FAST, and I brought some examples of that type of assistive technology just to give you an idea. So it may not be the exact equipment that you would use for your employee or that you're thinking about for a solution, but it can get you thinking about what's available and what we might be able to tell you about later on. So, assistive technology, I know that's a term that sounds all, complex, but it's not. Assistive technology is really any piece of equipment, any device, any tool that you can purchase, that you can make, that you can modify, that's already available to you, that when used by a person with a disability, it really enables them to perform at their highest level of function, to maintain their function, to do a task that they may not be able to do otherwise due to their disability. And there's also assistive technology services, and assistive technology services could be things like modifications. So a home, a vehicle, so that's what assistive technology and services refers to. I will show you a pen that we have, an adapted pen that I brought with me, I think. Yes. And that little adapted pen has changed more lives of all of the things that we have in our center than I think anything else. A little adapted pen that I've seen in bowls at Walgreens, a couple of dollars that it takes. It's certainly generated more tears than anything else that we have. People that have not been able to sign their name, write a check in 20 years, all of a sudden can pick up this pen and have a life-changing experience. That's what assistive technology is. So what is FAST? FAST is the state of Florida's Tech Act program, and every state has a Tech Act program. And the mission of these programs is to get this assistive technology out there and into the hands of individuals who need it. That doesn't mean that FAST will buy the equipment and distribute it, but it's more about educating people that it's available and having access to it and enabling different ways for access. So in the state of Florida, we have 6 regional demonstration centers around the state that enables people to come in and see this equipment. We happen to be based right here in Tampa. We're celebrating our 20th anniversary. But we do serve 13 counties, so even though we're here, there's people that we have to get out and take our show on the road, but we do try and get people into the center because there's so much there. So I can do a show and tell for you today, but I also want people to come in and do comparisons, to see the equipment, try it out, compare it to something else, learn about maybe another device that we don't even have that could make a difference for you. Once somebody comes in and tries it out, we can also loan that equipment because you need to see how it may work in the workplace, in your home, in the school setting. So we serve all these areas, and that's what assistive technology is for, is all areas of your life. We're going to focus on employment today, but you can also think about your own home, your family, people that you know. So always keep that in mind too, because not everybody knows about assistive technology, but once I talk to you about it, then tag you're it. Now you have to be the person sharing that information. So we want people to come in, we want to be able to have the equipment demonstrated, have it loaned, and we also have, at the state level, a couple of programs that could be beneficial to you and your employees. So FAST also maintains a statewide lending library of equipment. So even though we have a lot in our office, there's a lot more in the library. And all you have to do is go to the FAST website. It's FAST.org, fast.org, and you can look through their lending library and you can request that equipment be sent to you so you can try it out in the workplace. And you get to keep that for 30 days at a time, and then it gets shipped back. And FAST pays for all the shipping costs associated with that. So it's nothing for you or your employees to borrow that equipment and have it shipped to you, and if you can't get to our center. So this is another option for you. The other program that FAST has that I think is great is a financial loan program, okay? So That little pen doesn't cost much. You don't need a financial loan for that. But maybe you have an employee that was in an accident and now they use a wheelchair to get around. So how do they get in and out of their house now? How do they get in and out of the bathroom? How do they get in and out of a vehicle? How do they drive that vehicle? So assistive technology services are one of the things that FAST can help with through this loan program. They can provide a financial loan to enable a person to get these modifications done so they can get back to work. They can help with the vehicle that needs to be modified. Now, you know there's other resources like vocational rehabilitation that can also assist with certain things like driver controls, but maybe they aren't going to be able to help you to purchase a vehicle. So pooling these resources where FAST can assist with getting that vehicle that needs to be modified, maybe vocational rehabilitation can help with those modifications. So that's part of the way of looking at resources is combining those resources. Sometimes your employee might want to purchase the assistive technology themselves because they might want to have it and make it their own. Sometimes you as an employer want to provide that accommodation just like you do for any other employee who needs something. So that's where pooling resources comes together, but FAST can certainly be part of that equation. Okay, so I am going to do my show and tell for you today, but I want to ask while I'm standing here, are there any questions or any things that you might want me to make sure and cover as I'm racing through here?
Nancy, who qualifies for FAST services?
Everybody. Everybody in this room, all your employees. There's really no qualifications for our services. We want everybody to come in. We have targeted groups that we reach out to. It would be individuals with disabilities. It would be their caregivers. It would be their family members. It would be their employers. It will be the people in the education setting. It will be we work a lot with young professionals that are part of school. So we're at USF, we have South University coming, we have Nova. So these are people who are learning about assistive technology as they're being educated and understanding what role assistive technology can play in the lives of an individual with a disability. Another group is, we call them HARS, Health and Rehabilitation Services Providers. You know, being located at Tampa General and the Rehab Center, we certainly reach that population. These are the people that care for individuals when they're in a medical setting. And being exposed to the assistive technology at that time really lets a person with a new injury understand that they may not be able to do things in the same way they did before an accident or before their illness progressed, but they can still do it. When they leave the hospital, they're still able to go back to work, to go back to school, to be part of their community, and assistive technology can certainly play that role. So, moving over here now. So we talked about my little pen, this life-changing pen, and that's all it is. That enables somebody that can't grip a pen, they can't hold a pen, due to arthritis or pain or loss of digits. This little thing is what changes lives. Now, computer access is a really big area of many of our job tasks. There are accommodations, so to speak, that are already built into the computer you use. So how many of you have discovered you're better spellers when you're on your computer than when you're writing? Well, you can thank Bill Gates for that because he autocorrects a lot of your misspellings. But you're not limited to the words that he put in there. If you worked for Florida Alliance for Assistive Services and Technology, you would not want to be writing that out every day. I'm not saying I'm lazy, I'm saying I like to be efficient. So what I do is I put into that autocorrect feature the abbreviation FST. And when I type FST, then I get Florida Alliance for Assistive Services and Technology. That makes me efficient, but think about the individual that really has trouble with those keystrokes and may not be able to do a task that's typing that quickly. But with that abbreviation expansion feature or even word prediction features that are built in, then that's enabling that person to do that task, okay? There's options. I don't like to have to double click. I don't think that's efficient. Somebody else, it's just they can't double click, it's painful, or the mouse moves around too much. So I have to change my settings on my computer, which IT at the hospital hates me for that, and all the little changes I make, but it makes me more efficient, or I think it does. So these are things already built in. That's assistive technology for individuals with a disability. We also had someone who is a quadriplegic that taught our computer classes as a volunteer. So he had movement in his arm, but he couldn't type. You know, he didn't have the ability to type with his fingers. So this is a simple typing aid that allowed him to type using the keys. He used, instead of the mouse, the regular mouse, you can use like a trackball like this and move that little trackball around. You can program your left and right clicks. You can make them a double click for just hitting it once. You can drag. So there's programmable features in there. Also built in are things like on-screen keyboards. You know, so if typing is difficult, you can just use your mouse and use that on-screen keyboard, or the magnifier that's built in, or the voice recognition that's built in. So instead of paying for that very expensive program, maybe all you need is what's built in. But sometimes you need some adaptation. So this is a keyboard. You can see it's smaller than a typical keyboard, and you don't have to press down. It's not painful for people who have that difficulty because you don't have to press, you just have to break the plane. So that's an adaptive keyboard. This is another adaptive keyboard. So if you can't see the letters and numbers on there, this gives you better contrast. It also might have a better touch to it that's not as hard to press down. You may not have to buy this. You can buy labels to put on your keyboard that are larger, and that's a couple of dollars. So those are simple solutions. In terms of queuing and reminders, depending on the individuals you're working with, sometimes like if you've worked with vocational rehabilitation, they have what's called job coaches that can help an individual learn the task and do the sequencing of tasks, but there's also other options where you can maybe do it yourself. So these are just little task books that we've made up that shows you the task. You take pictures of the different steps in a job. This one is, you know, packing a box to ship it out. So we took pictures of each step. So it has the pictures, it has the words, and it has the sequence. So you don't need somebody standing there next to you going, okay, now grab that box. Okay, now grab that box. Okay, now grab that. So you can do it yourself. You just have that queuing available to you. And if you have several tasks, then you can have several pages. It's whatever you want to do with it. This is another option where you may need auditory. So this is again a sequencing. I don't know if this is on, but so it takes you step by step. You know, some people in the morning, whether it's from an intellectual disability or cognitive disability, they forget the sequence. They might get up, they might brush their teeth, they get dressed, oops, forgot to shower. So there's ways of queuing and sequencing that can be of assistance. This is another, talk about buying things off the shelf. I don't know how many of you ever seen an Echo Pen. You can get it at Target or Best Buy. It's really great for students who want to take notes in class. It comes with a special notebook. And instead of like writing down every single thing that's being said, you can just do headlines or categories. And then it's recording what's being said at that time. And then you can always go back. Oh, she's talking about computers. Let me go back to that. Oh, now she's talking about queuing. Let me just go down. And then you can just pay more attention. So in addition to that, which can be uploaded to your computer or to an Evernote app or directly to your iPad, it also comes with something like these sound notes. So this is another sequence for somebody that needs to follow it depending on the person. It's all individualized, but this is simple. You take the ingredients of, this is tuna salad, just so you know. So you have it numbered, so it's 1, 2, 3. It also has the words next to it. Bowl, onion, celery. It also has a picture. Then it also has the ability to, you can record whatever you want. Let's see.
How to make tuna salad. Things you will need. Bowl,
You can't hear, right? This is an onion. All right, so, but you get the idea. So you can hear what's being said. So that's a self-cueing. It takes you through the steps. So I just let you know about 3 different options right there that can enable a person to do something on their own. And just to keep going with some examples that I brought, this is simple environmental control. So someone who maybe needs to get up and turn a lamp on, or they need to turn on any kind of on-off device. Maybe it's difficult to do it, maybe it's difficult to get over to it. So you can just get this little controller and then plug in up to 3 different devices. There's 3 that come with this. So you can plug in the light. So you don't have to go in the other side of the room, you just hit the button and it turns it on. That's environmental control. That enables accessibility for a person to get around, and also you don't have to turn it on the way we typically do if you can't do that. This is an example for someone that has a hearing loss and has difficulty hearing what's being said in the workplace. So these are just headphones you put over your ears, and it has a little microphone on it. So if I'm someone and I'm talking to you one-on-one, I'm having a conversation with my boss, this is aimed at you. I can hear better, potentially, by wearing these headphones. Okay, so if I have a hearing loss that can be corrected through amplification, this could do the trick. We've also had people, and this we had someone here in Tampa, you can instead plug this in and put it on the table itself, and that way, instead of it being one-to-one, it's that everybody's sitting around the table. So if you're in a meeting and you're trying to look at a person and they're facing the other way and you can't hear what they're saying, by placing this, it amplifies what's being said around the table. And that makes a difference for somebody that's in a meeting and just has difficulty. And then this for someone, just examples, someone with a visual impairment, maybe you have to go into a large warehouse and it's got the different signs everywhere and you don't have that ability to see that far. So this simple monocular, you can look through it and you can see things at a distance. You can see it up close too with the macro function, but it enables you to find where you are and target an area that you need to go to. This is something, someone I know that has a visual impairment wanted to see his son play soccer. So this is what he used for that. And for everything that I talk about, every area, whether it's vision or hearing or mobility or cueing, reminders, communication, there truly is an app for that. And just to give you an example, and I don't know how much time I have, but for this app, which is set up for an alarm that's on here, the employer seminar, it reminded me about that. It was probably going off while we were talking. But there are, in the same ways that I talked about some of these cueing devices, there is an app that can assist with that. And there's free apps, and there's apps that are a couple of dollars, as you know, and there's apps that are hundreds of dollars. But for example, this comes pre-set for certain tasks. So to give you an idea, if your task is making coffee, it takes you step by step through. So you can hear it, you can see it. If you need to go backwards, it'll do it.
Making coffee this morning.
Essential part of the job, or maybe it's a benefit. It's essential for me. All right. So that gives you an idea, and then you can also create your own. Just as I showed you taking pictures, these are things you take pictures and you put it in there, and you can create it and make it individualized. You can also do, this is another one where this is a task that somebody has to follow every day. So this is in sequence. So what's the first one?
turn off the computer.
Turn off the computer. Okay, I've done that.
Clean off your desk.
Okay, I gotta clean up. Y'all never get that one done. This is a task of locking up at the end of the day. So it just takes you through it. You can follow the sequence of doing that. And then you start out and you do it again, you reset it, and you do it again the next day. So that's something you can do on your own. And you can just create whatever you want to create with that. This is another one where, this is already.
I love the tram.
So somebody took a picture and then it reads, it highlights as it reads too. You can set it up to go automatically. But again, there are many different options for doing it. We don't have to go through all the foreign ones, but that was a good example. It's done, it's another one that gives you tasks, and then you check it off, lock the car, check, lock the door, check, take my vitamins, check. Whatever you want to put in there, you can do. And then you can also set it up that it will send a text message or an email to either you or somebody else. So if you're that person that, like, did I turn off the light? Did I turn off the stove? I better go home and check again. So with this, all you do is check your phone. Nope, I did it. Okay, or your caregiver knows, okay, they remembered to go to work today because they checked it off and I got that email. So you can do with this what you like, but these are different queuing methods. There's, for people that have difficulty maybe reading what's on there, you can either take a picture or you can download from a website. Let's see, Alice in Wonderland we all like. And so
Finding that nothing more happened, she decided.
so it
to go
highlights
into
it,
the
it reads it
garden
out loud. With this one, I just
But
condensed it so you don't see everything on the page that may be confusing for
and she
everybody.
forgotten the little bit.
Okay. And so there's,
That story.
you want to hear more? I'll tell you where to get that one. There's also, if you have employees that have difficulty with communication, they're not intelligible to you. So it gives an opportunity for them to communicate with you more easily. There are many free apps that allow this, but there's also apps that are more expensive because that's what's needed. You have to have more novel speech, but this is just something, let's see.
Welcome to FOST.
Well, you can't edit the pronunciation of that, and I like it to look right rather than always sounding right. But you know, you can make it unique. It has all these different categories.
Welcome to FOST. What time is the meeting?
Time is the meeting.
When you like that pie, can I help you?
So that's all employment. That's all the work category. But you know, maybe you're traveling. You know, so.
Does the transporting have a ramp?
Okay, so you can ask these questions on the fly. You're not stuck being unable to communicate with somebody. So those are definitely beneficial, and I could spend all day going through communication apps, but we're not going to put up with that. This is something if, let's see, if I can find the camera on this. Yeah, there we go.
$1.
Okay.
$1.
All I did was put this dollar bill in front of the camera and it told me what the denomination was. Can you think of how beneficial that would be, you know, for someone? And there's also apps where it doesn't say it out loud, it just vibrates according to the denomination. And then there's also, we talked about Jan, the accommodation. There's also an app for, it's called CAPS, it's the federal assistive technology. It gives you some suggestions of accommodations. It'll give you highlights of different apps and programs. You can follow different modules and tutorials. So literally for everything I have shown you and haven't shown you, there are solutions for that. So now that I've thrown all that at you, what questions might you have? I usually try to overwhelm people and they're like, oh my gosh.
I have a question.
Sure.
The scanner you just used to see the denomination of the dollar.
Yep.
Is there one like that that is a CCTV for the iPad?
Is there a CCTV where you can put this under the camera and read it?
Yeah, like a reader.
Yes, there
Or
are.
the iPad?
Yes. Yeah, yeah. I mean, it's never going to be as good as that, but you can certainly put cameras on there, and like we have a stand, and you would put it underneath, and it can change the color and the contrast and the size, so you can make those changes. Thank you.
Okay, it's my pleasure to introduce Kate Bearling, who will be moderating our employer panel. She runs a nonprofit, Change of Course Incorporated, that she founded in 2008 to promote the employment of people with disabilities in partnership with the Department of Education's Vocational Rehabilitation Division. She is also, and she's been like a right arm, one of the co-chairs engaged in the strategic planning for the Mayor's Alliance Job Fair for veterans and persons with disabilities that will take place on January 23rd. And I just want to say there's information on the job fair in the back. Thank you.
Thank you, Karen. Good morning. Good morning. Are you here today because, like our speakers and our great panelists, you want to make a difference? Do you feel equal to the task? The Office of Disability Employment Policy, ODEP, each year creates a new campaign to promote awareness. Their message in 2013 was, because we are all equal to the task, and I'm equal to the task of bending down. Clearly, stereotypes need to be broken down, but I would share that there's more to that message. For every person with a disability who's seeking equal access to an opportunity, there's someone, it could be you or me, who'll be called upon to be an ally. And when facing new challenges, we all can have doubts about our own abilities to do what is needed. Perhaps, as Jack Humberg had said, we've failed to interact and ask what is needed of us. That's why it's such a pleasure today that I get to introduce our panelists and move on to this segment, because at some point in their career, when they were starting out, they passed through their own self-doubts and made a decision that they were equal to the task. I'm sure they'd be happy for me to share they're not public speakers. They weren't trained disability advocates, but rather they are a once aspiring chef, a former graphic designer, and a human resource professional. So let me proceed in introducing our panelists. To your right, may I introduce Bill Dietz. Bill has been a project manager with Gulf Coast Enterprises for 8 years now. Gulf Coast Enterprises is the 27th largest food management company in all of the United States. In 2014, Gulf Coast Enterprises was recognized by the Department of Vocational Rehabilitation as an outstanding exceptional employer of people with disabilities. And then in 2013, the year prior, when a survey was conducted in all of Tampa Bay, 35,000 people were surveyed, they were recognized 4th as the #1 place to work in all of Tampa Bay. Personally, for Bill, within his own department, of his 27 employees, at least 30% at any time have a hearing impairment. They're either recognized as deaf or hard of hearing. And Bill personally has become fluent in American Sign Language, and he's seeking his certification with St. Pete Junior College, I believe, St. Pete College. His story, as he said, our aspiring chef, is revealed here, is that he did aspire to be a chef, and that at one point his mentor said to him, if you want to keep a good marriage, you may want to get out of restaurant business. And that's how he fell upon the good fortune of being with Gulf Coast Enterprises. Now, next, if I introduce our lady of the panel, Harriet Jordan. So Harriet Jordan, she's the human resource business partner at Mera Group. It's a managed care organization. And she has her MBA from Florida Atlantic University. And while we're graced with her presence in Tampa directly, she's actually responsible for all the human resource functions in Louisiana and Florida combined. Harriet also, on behalf of Mera Group, is actively involved with the Mayor's Alliance for Persons with Disabilities and has been contributing for many years. Like Bill, she specifically mentioned prioritizing her family, which includes her husband, Sam, and I was asking her this morning, her labs, Buffett and Calypso, who I asked is the name Buffet, but she corrected me, let her know that her dog is a Jimmy Buffett fan, along with her. So she joined AmeriGroup about 10 years ago, but similarly, it was about 8 years ago when she really took notice of promoting the employment of people with disabilities and led in that. To your far left, Ben Barkley. Ben is a manager for the Community Command Center at WellCare. And that company has commonalities with AmeriGroup, and it manages the benefits for Medicaid and Medicare recipients. And like Bill, coincidentally, there's that number 8, he joined on with WellCare about 8 years ago. Before that, he was our graphic designer. And at WellCare, he's made steady progress with promotions, including from project manager to moving up to senior business analyst, and again, the manager for the Community Command Center. Among his staff, which I believe to be 60, he shares about 90% happen to be persons with disabilities. And when we were sitting down and talking about his role, one of the good problems or laments that he had was that his department is an area for onboarding and promotion, so that he often is there supporting and helping to groom people as they're moving and advancing within other departments. So it's my pleasure to introduce the panel, and I will go take my seat. Thank you. Now, I'd like to add that one of our low-tech assistive tools that we're using today is, for the sake of timing, we have a cue card that will be shown to our panelists, and it will reveal to them, it's the green card, at 2 minutes. We're at 2 minutes in answering, there'll be a green card. At 2.5 minutes, the yellow card will come forward, and at 3 minutes, the red card. And then we will proceed. So, we were talking about essential features of the job. May I ask each of you just a brief response about what are the top 5 qualifications or qualities that you require in any employee that you hire? And let's just start from my left to right. Ben Barkley.
So, they would be easygoing attitude, ability to adapt to change, a self-motivator, an independent worker, and also a team player.
Thank you, Ben.
Change is the most important.
I like that. My company's change of course. Harriet?
I can say I echo those. I think that the first thing and foremost is enthusiasm and a passion for what we do. So the person has taken the time to learn about our company and really comes in and just really shows that they really care about that. What we do is we serve Medicaid members, and so a lot of times we are able to actually hire from our own membership. Positive interactions, absolutely have to be flexible and adaptable. I think all of our environments today are extremely fast-paced and changing. Being on time, honesty is a core value for us, so just demonstrating that through the interview process as well as their meeting with the individuals, and then just share their work experiences in a positive way.
One moment, can I share? I'm leaning into my microphone. I don't know, each found yours, you have one in.
Give us these other ones too.
The other is a telephone mic. It's for the television.
This is extremely high tech.
There you go.
We weren't prepared for this.
Thank you. Bill.
Good morning. Can you all hear me? At Gulf Coast Enterprises, our success is grounded in our pillars of excellence. Those pillars are the best people, the best service, the best quality, the best financial performance, and all those lead to our growth. In the interview process, we try to identify those qualities in every person, and so the things that we were looking for is an honest person, We know people with disabilities have challenges keeping jobs. And oftentimes when you're applying for a job, you don't want to say that you were fired. Coming to interview with us, we don't see it that way. If you were let go or if you weren't successful on a job, we'd rather know that right away. And if you're honest with us, that's one of the traits that we're looking for. Courteous, somebody who always uses the golden rule and is respectful, sir, ma'am, things like that. Obviously, respect. Respect in the workplace is our, biggest goal. We want everybody to feel safe and respected in the workplace. So have a positive attitude. A lot of people have experienced failures or difficulties maintaining a job, and they can be not as positive about the outlook of the interview or the outlook of getting the job. And so we're looking for people who have that positivity that they can bring to the team. And then somebody who's really eager to learn. You don't need to know how to do what we do, but you need to be willing to learn and give it the best effort you can. So those are the things that we really look for in the top 5 qualities.
Thank you. So, to our lady in the middle, Harriet, may I ask, how does your company celebrate diversity, and what motivated you to be on the panel today?
Our company is committed to diversity and inclusion, and as I think many companies are today, we have a very, very robust intranet. And so there are a number of ways that we are communicated with, but we have a diversity and inclusion page, and on that page for us are toolboxes for our managers to use on everything from disability etiquette to just many things about hiring, and so those toolboxes are extremely helpful to our leaders. We also have a number of associate resource groups. This is something fairly new for us because for those of you who know me and have been interacting with me over the years, we were AmeriGroup, and we were acquired in 2012 by WellPoint, and WellPoint is a much larger organization. So we grew from about 5,000 employees to about 50,000 in one swoop of a pen. And so with that came so many more tools. And so the associate resource groups are something that we did not have at AmeriGroup. We were starting to put into place. And we have so many different associate resource groups. And those associate resource groups are really helpful to everyone in the organization. So for example, for Disability Employment Awareness Month, we have a group called ABLE, and I apologize because I can never remember, Abilities Beyond Limited Expectations. And that group provided webinars every single week during the month of October. And those webinars were educational to us, and how can you accommodate me, or how has the company accommodated me, and here's things that we've done. We all learn from each other and from these groups. And so for us, this has been such a learning experience for the company to embrace and hear so much from the individuals and really include that throughout our day. We have each other. To your point about why did I want to be on this panel, it's just something that I started to believe in. So years ago, I was in human resources, and I said, everyone is just coming and applying for my job. I had a barrier up, and where I really felt that I didn't need to reach out or be involved in different types of organizations, because I just assumed that everyone could come to our website and click on a link. And so I met Sandy. I saw Sandy was in here just a little bit ago. Sandy Soroka. I had the pleasure of meeting with her, and really just meeting with individuals like this and learning from each other. We are resources for each other, and just watching some of the demonstration and even listening to the things that Jack said, there's another resource, there's someone I could reach out to. So it was purely a personal motivation, because I just felt that it was the right thing to do, and you know, we want to keep sharing that and paying it forward, you know, to all of you. How was that?
Perfect timing.
We apologize, that's my phone that's doing it, to you and Larry, so. Was there anything
That's it.
else? Okay. Ben Barclay, may I ask, overall, how has your company, WellCare, successfully benefited from the hiring and retention of people with disabilities?
So I would say I've only been hiring manager for like a year now. So going into it, I didn't have any expectations or biases from it. But I think there was a stat out there that like 90% of the people that are disabled are either unemployed or underemployed. And I would say for everybody that we hire, they're underemployed for what we have them doing. So it will give us a better way to fit them into our organization somewhere else. And truly, they just really want to be working and they want to be out there feeling a part of America and doing their job, and then being able to go somewhere else and do what they really want to do rather than doing a data entry job that I have them doing. So that's how we benefit.
Thank you. Bill Dietz, may I ask the same question of you, and to repeat overall, how has your company successfully benefited from the hiring and retention of people with disabilities?
Well, our sole purpose for existence is to hire, train, retain, and successfully employ people with disabilities. To that end, there are a lot of measures of success, but I'd like to share today part of the welcoming message from our CEO that every employee gets. He's talking about our reputation, and he says, in the end, all we really have is our reputation. Our employees have contributed in building this reputation since 1986, and now we entrust unto you to add to it. Employing people with disabilities has directly propelled Gulf Coast Enterprises to the top of many of the measures within our entire organization. Our employee engagement and morale consistently tops out our corp. We have retention rates that far exceed the benchmarks, the industry benchmarks of the Bureau of Labor Statistics across all of our industries. And the reason I feel that is because when you hire people with disabilities, what you're getting is somebody who is so eager to work that they're willing to do whatever it takes to go above and beyond to prove that you made the right choice. I was doing a attendance report for the last year, and out of 20 employees who have disabilities, we had 33 days missed total. 1.5 days missed per employee average. I have employees who have worked for 14, 15 years with me who have never missed a day of work. That's the type of dedication and commitment that you get from hiring people with disabilities. That's the kind of employees you get that will help you build a reputation. As Kate said, we were recognized by the Agency for Persons with Disability as the exceptional employer for the state of Florida. We have also been recognized as the 4th best mid-sized company to work for in Tampa by a 35,000 member survey that was done in 2013. Since 2006, during this Great Recession, we've increased our revenues by 300% and opened 2 new business lines. I'm getting the right card. We can come back to that later. Thank you.
Thank you, Bill. I look forward to coming back to that. So, Harriet, How has AmeriGroup made their hiring process accessible for people with disabilities, especially in regard maybe to online assessments or the application process?
Yeah, as I was saying earlier, when I was, a few years ago when I started down this path, I assumed that everyone just went online and clicked and did what everyone else did. And I didn't realize then that even as a company, we had so much learning to do. And so today, our recruiting has now been centralized with this new acquisition. And one of the ways, it is the online application, but right on the online application, there is need an accommodation, need help. Click the button, there's an email that's sent, and then the recruiters can reach out directly to the applicants and have conversation if there's some difficulty in completing the online application or whatever it is. The way that has also benefited us is our applicants do complete an online application, and then once that's completed and submitted and there perhaps is an interview being scheduled, again, they can still use that, need some help, need an accommodation, and that has allowed us to be prepared for maybe a relay conversation or other types of accommodations that might be made. So we've made a lot of progress. I can tell you that it is a learning experience every day. Technology is changing. We've seen some today. We have a couple of individuals, and I've been very fortunate to hook up with some organizations locally that there is no dumb questions, and so this has really allowed us to maybe break down some of the barriers that obviously in the first place I didn't even know existed. And so I just encourage you to take a look at that. Coming to something like this today and just hearing it is one step in that direction. And so we feel that we have made progress. We feel that there can be more progress. When I look at some other sites, I may have to go check out my competitor here. But there I go, why didn't we think of that? So there's a lot of sharing that can be done amongst each other, as well as things that we come to this way. And I'm not afraid to raise my hand. We are a big corporation now, and I'm not afraid to say, hey, what have we thought about this? And sometimes we have, and sometimes we haven't. So sometimes the way we've always done it isn't always the way that we need to continue to do things. So that's kind of like a multi-part to your question, but hopefully I answered it.
Thank you. Appreciate it. So, to get where we're here today, to ask a bit for your stories, how about Ben? Can you please provide an example of how you've accommodated somebody with deafness? And I think you mentioned you have an employee who also has visual impairment.
Yep. So I have an individual that has both visual and hearing impairment. She's been with us for a little over a year. We had her get 2 larger monitors so that she could increase the size of the programs. I believe they're probably like 25-inch monitors. She also has a webcam that she can focus on a piece of paper and make it larger on the screen if the print is not large enough for her. She's tried the FM amplifier thing in meetings, and it really hasn't worked too well for her. So we've had implemented where when we have meetings, try to write out everything that we're going to talk about so that it's there on paper. She can follow along. If she has any difficulties hearing us, she can at least look down the paper and see where we're going. We've also provided in really large team meetings the cart service, which has been extremely helpful in being able to follow along. And then the individuals that we have that are deaf, we have recently given them a video relay phone that they can be able to make phone calls out for us, and they can still do more than just data entry. They can get involved in everything. And then the person that is visually, she's not, because of her vision deafness, she has trouble with ASL, so that was the reason why we brought in the cart service for that occasion.
Thank you, and I appreciate you mentioned there is some trial and error. You tried the FM during the meeting, and moved on to the next.
And I will add to
Yes.
that, because I will tell you that my first venture was an epic failure. But it was truly a, let's ask forgiveness, then permission, and that's why my IT guys sometimes are like, what are you doing now? Because I did hire someone who had a hearing disability, and we tried the video relay. We just were not prepared, especially when it came to our training. We're not prepared, and so it didn't end up as well. And so our second time when I was, and we still have the employee there today, and she has a visual impairment, and Lighthouse for the Blind partnered with us and is there quite frequently. Still meeting with her. It's been over 5 years. She's still there. Awesome employee, and I'd just like to add, and maybe you all are going to talk about this, lots of free services. It does not cost what you think it's going to cost. In fact, it has been so much lower than anything we anticipated. But how we figured out that we really had some really barriers in our workplace was Sandy Soroka came to visit our workplace. We had a business leadership meeting, and she came into the reception area, and our reception desk was like 4 feet high. And Sandy, I know you're here, but when I was like appalled that here was a person who uses a wheelchair and she couldn't see our receptionist, and so we made a slight change, just lowering the counter. But it was like, oh my gosh, there's so many eye-opening experiences, and they aren't that expensive.
Yeah, I just have two other things. The video relay service, like she said, is definitely free. They'll come, they'll install it. It's free. And the person that is visually and hearing impaired, she is one of the best data entry person that I have. So she does 10 times more than everybody else. So yeah, she's very good.
Harriet, just returning to you, you mentioned you're an employee with a visual impairment or maybe blind, and you work with the Lighthouse for the Blind. Was there anything else you would add about accommodations when working with the individual?
Yeah, with that, first of all, I made it very clear up front that this was a learning experience for both of us, which was the right thing to do. I said, I'm going to make mistakes, we're going to make mistakes. Partnering with another organization such as, like I say, Lighthouse for the Blind, was just the right thing to do. We also have some very specialized software that is used, and so they've worked with us to make sure that the Zoom software can work in our environment. They have provided keyboards. We have used them for a number of things to keep up to date for this individual because she works on the phone. She is a customer service rep. We were not able to get JAWS to really work yet, but it is now working. It's taken a few years, so we now have it working, and we actually do have an employee who's transferring to us from another state next month who will be with a guide dog. And so it'll be another learning experience for us. And so every time that there's an experience that we just don't know, I just work with the individual because they know what they need best. And being that open and honest and not assuming something is what has really allowed us, I think, to be a little more successful. So.
Thank you. Thank you. So, Bill, you are fluent in American Sign Language? So if you'd share with us how you personally and Gulf Coast Enterprises accommodates people with hearing impairments or deafness.
In a lot of the same ways that they described, we are on my site, for every meeting that we have, or every function that we have sign language interpreters. We also use, there's also interpreting services that you can use over the web that require, they don't require a 2-hour minimum. A lot of interpreters will require a 2-hour minimum charge for a 30-minute meeting. If you're lucky, it only costs $100. You can use video apps or video relay services that will do meetings for like $1 a minute. And there's, I think, a 15-minute charge or a 15-minute minimum. So, but during the interview process, we make sure that if there is not an interpreter provided, that we'll bring an interpreter in. I can usually sign well enough to conduct an interview one-on-one, but I don't sign well enough to conduct a meeting and sign at the same time. So, like I said, we bring in interpreters. The other things we'll do is make the job cards. There was an example of a similar type of job card there for some of our staff who happen to work much better from a list. They know what the next task is. They can prioritize their work much better that way. And then we have a few employees who write notes, and it's kind of interesting. You'll go into our what they call paper storage, and there'll be conversations written on boxes from years ago. Geez, they just write everywhere. It's kind of funny to go back in there and read some of those conversations, and they're interesting. But notes, you know, and not to be afraid. You know, don't worry about making a mistake. If you do, just, you know, move on or apologize and move on. You know, we'll all make mistakes in regard to that, but you know, making the effort to communicate with each and every staff member effectively is really what everybody's looking for. And so, you know, whatever way you have to do that, whether it's a notepad or an iPad or an interpreting service, that's what we do.
Thank you again to all of you for repeating that message, just to take the risk and ask what is needed of us. So what I also wanted to ask is, Harriet, you mentioned an outside support, an agency. If anyone wants to add what other additional outside supports you've reached out to, who might want to share?
So I've used Sorensen for the video relay service, and I've reached out to FAST in the past to help with accommodations for computers.
Sorensen Video Relay, Sherry DeLutis and Associates for interpreting. Department of Voc Rehab has reached out and offered assistance. Lighthouse for the Blind. McDonald's Training Center, I know, is working a lot with our Tampa services, Tampa contracts. And we have a really good support team up in Pensacola, and with our federal customers with Ability One. If there's ever anything training-wise needed on any Ability One site, whether it's from a provider or just anybody working on one of those sites, can call them for any type of resources, and they'll come to you on-site training over a huge host of things.
Thank you. Jack Humberg in his PowerPoint presentation had some stats about the typical cost of accommodations, and Nancy showed us some low-cost accommodations. Maybe, Ben, can you share with us some examples in your own company?
Yeah.
Of low-cost accommodations?
Yeah, so we budgeted for each employee $500, and the average has been $75 to $100 per person. It was just for like their desk stuff, not building stuff. Low-cost things that we've used for like the people that are deaf, we've used dry erase boards, little mini dry erase boards that you could carry around with you and write notes on it rather than like pieces of paper and finding them in boxes. So, and then the video relay service, which is free. So, yeah, those are two examples.
Harriet, would you like to add to that?
We did not set a certain budget. It was like, well, I'll just cross that bridge as I get to it. But honestly, we've been very pleasantly surprised. Again, it's very, very low cost. I would agree. You know, if we spend $100 for anyone, we make accommodations. It's a surprise. I mean, usually they're zero, and so and pretty minor. It's way less than everyone anticipated. I think the fear of the cost is probably way bigger than the actual expense itself.
Yeah, we have very similar at our site. Everybody set their clocks back recently, I think, or your phone's updated automatically, and so we have a couple of our employees with visual impairments who, in low lighting situations or when the lighting is changed significantly, allowing them a little more time to adjust, allowing them to finish their work prior to the sunsetting, or providing them with a simple flashlight to get back from a building back to the time clock to be able to walk safely. Things like that at very low cost. We're not recreating the wheel, and you know, when all else fails, we have support services and job coaches and the employees who know best what types of accommodations they need. So very low cost for most accommodations, I would say.
Thank you. And Bill, you mentioned time adjustments as an accommodation. So Ben, we were speaking before about accommodating somebody with a behavioral health disability, like anxiety or depression.
Yep.
How might that factor in?
Yeah, so I hired an individual that had anxiety issue, and like the gentleman talked about, it wasn't made aware to me during the interview process. I got an email from his father, like thanking me for hiring him and telling me that he had anxiety, and anything I could do to help keep him out of large groups settings and talking in front of large groups would be best. So I put him in a cubicle that was by a wall, so his back was to the wall. He's in a corner close by to him, mostly by himself. There's a little bit of foot traffic, but not a lot. So that's how I accommodated him for his anxiety. So he's done well.
Great, thank you. Did anyone want to add to that?
You know, allowing I would say just being accepting that some of our staff who have maybe severe depression every now and then will have a bad day, just like any one of us. And you know, we may show up to work in a mood that doesn't really, they're not cheerful, or they're not you know, smiling, beaming, but just being accepting of that and knowing that that'll happen to anybody. And I don't think that there's a major need to treat anybody else differently in regard to that. I've had times where somebody with a mental illness was having a difficult time, and for a week straight was, you know, 10 minutes late. Oh, what's going on? Well, I just, you know, really didn't want to get out of bed, really didn't want to get out of bed. But this is somebody who also walked to work in a tropical storm, and the only regret that they had was that they didn't, or excuse me, rode their bike to work in a tropical storm, and the only regret they had when they came to work with their beaming smile was that they didn't walk, because he could have used an umbrella and stayed a lot drier. You know, so I mean, you know that will happen, and I don't know if it's an accommodation or if it's just being human, and we all go through it. You know, there's times that I'm late for work because I didn't want to get out of bed.
As promised, time flies when you're up here. 2 minutes or less this time. Bill, was there any closing remarks, anything you wanted to share that you haven't had a chance to say?
I think that the message today would be to open your hiring practices to the 3 million or 3.5 million people with disabilities in Florida who are not employed, and to realize that there's a huge resource of highly motivated and qualified people that you can employ that will make a significant contribution to your company's morale. As a manager, having to manage when people are absent frequently is something that I don't enjoy, and it's something that I don't have to do a lot of. And I will tell you that people with disabilities, when you give them the chance to prove that they are capable of doing the job, will go to great lengths to prove that day in and day out. And it's just about giving somebody a chance and relying on their resources and the other resources that you might have available to you. So that's all I really wanted to convey today.
Thank you. And Harriet?
I think for me, we make efforts to hire the right persons for the job, and if it happens to be a person with a disability, okay. I think the hard part there, though, is our managers, and our managers and hiring managers are sometimes afraid. And so it's providing the managers the tools that they need to be able to overcome the fear. And for our managers who have hired persons with disabilities, they do find they're easier to manage because they're here every day, usually very positive, which doesn't always exist. And so it really is helping our managers through the process. We're afraid we're going to say the wrong thing. We're afraid we're going to do this. We're afraid we're going to do that. And really just educating, again, even some of the resources that we've seen today, having these individuals come in and let's practice. We can do this together. And overcoming that fear has been a huge lift to the organization, and it is a win-win situation for everyone. And so truly obviously believe in it, and but helping my managers through has also been one of the bigger challenges. That's it.
Right. So I have a couple of thoughts, but first I have a plea. So I have a gentleman that was a veteran of many military branches, and I just come to be made aware that he has post-traumatic stress disorder. So if anybody has experience working with that and helping manage it, I'd take any thoughts. So I would say that people with disability are very loyal. They are there to help you and not the other way around. Most of the time it's more about how can you help me. So, and then I've had 3 individuals that gained full-time employment elsewhere outside of the company, and one of the individuals had made the statement, she went to another healthcare organization. She said if it wasn't for WellCare on her resume, she would have never got the job. So,
Did I hire her?
no. Yes, that's it.
Thank you, and we all have a call to action. And in Ben's invitation to talk, to know that at the end, which we're wrapping up right now, we're not going to come back this line. We're not supposed to be past it, but they'll be here to speak and talk to you. So Helen Keller once said, "I long to accomplish a great and noble task, but it is my chief duty to accomplish small tasks as if they were great and noble." That's my favorite quote. So we sincerely thank our panel today, Bill, Harriet, and Ben, for sharing their example of leadership and how they are equal to the task. And I'm hoping that you will find inspiration from them. And if I can lead you in a warm applause